Many students believe the H1N1 or swine flu epidemic is nothing to worry about in the United States anymore.
I'm not really scared of it. It's just like, I don't know, normal flu.
It's not like deadly unless you just kind of let it go crazy, and I kind of take care of myself, so.
However, Health Center Director Patricia Boris says the flu has affected many students on campus.
We've only had a couple cases in this week, but we were probably seeing about 20 cases or more a week. Sometimes I think the most we saw was about 12 per day in a few days. But yeah, it's significant. We've had a significant flu on this campus. If you think it's not here, it's here.
If you have flu-like symptoms, you should stay home from work and school. Some students went to the health center when they felt sick.
Yeah, I think they're doing the best that they can providing the vaccines to students on campus. It's easy to access and for a cheap price, so I say yes.
I've gone in there a few times and I was sick and they told me I wasn't, and then I went to my real doctor and I really was sick. So I don't know if they do that good of a job.
So we adopted all of the measures that the CDC and the New York State Health Department have been recommending as far as self-isolation and hygiene, and of course the vaccination, which has been a bit of a problem.
The H1N1 vaccine is currently available to students, faculty, and staff, but some students are choosing not to get it.
I don't know, just with class and practice and everything, it just seemed out of the way. My mom wanted me to.
We never really got around to it. We got the emails from the health center saying that they were available, but we just never really made our way there.
Expecting mothers, children, and young adults are especially at risk for swine flu.
Put the whole thing in perspective, I mean, you know, they say nationwide 30,000 people die of the flu every year. The majority of those people are people that are sick with chronic medical problems or elderly, but this particular flu hits children and infants and young people because they have no immunity. So still the number of deaths are comparatively very low, but when you start having children dying of it, it's more significant. And
so what can you do to prevent yourself from getting sick?
hand washing is absolutely the biggest. The old coughing into your sleeve, just not using your hands and then spreading it. Everybody thinks swine flu is gone, and I really do think that we're going to see a resurgence of this in the winter when everybody is back in closed environments and indoors, and that's when we normally see flu. So the virus isn't gone, it's here, and I think we're going to see it peak again in the winter.
For the Student News Project, I'm Erica Wolfling.